Hi, everyone. Welcome to the What's Happening at HFA webinar, the Advocacy Policy and Choice Overviews. This is your Advocacy and Policy team. I'm Katie Verb, and you'll also be hearing from Janel Johnson-Momani and Wendy Owen. To start, I would just like to say if you have any questions, please send them at the end, or if after the presentation you have any questions, feel free to email us at advocacy@hemophiliafed.org. And also, always check back at our website for new stuff. We're posting new advocacy stuff all the time. So to start, speaking of our website, next slide, please. One new thing on our site is the Appeals and Grievances section. It is designed to collect stories about problems facing our community with insurance companies, most prominently denials of services or payments for services. We have got a form filled out that you can let us know, obviously privately. HFA will not share information if you've been denied a service, what's happened. And this is really important for us as advocates as we move forward to have these stories and to collect these stories as we meet with executive agencies and legislators on your behalf to talk about how necessary rules are affecting our community and how they might not be working great for us. So it's really important. Also, we're about to build out that form a little bit more even and ask a series of questions about provider changes, because I think that's something we've been seeing in our community. For example, has your insurance company narrowed your choice of provider? Is your doctor covered but not your hospital? Are you not able to choose your pharmacy, things like that? So we can continue to collect those stories and see how these things and all of these new developments are affecting our community from an advocacy perspective. And you can see that the URL for the site is there. So please visit, and if you've had any issues, fill it out, or let your other community members know that it's there, and it's a really good resource. Next slide. Also, another thing that we've just put up is the specialty tier Share Your Story. I'm sure most of you know that specialty tiers is a big issue, both federally and in states right now. There's a federal bill, HR 460, that we've been working on, and we've just seen a lot of bills pop up in states. So we really would like to collect stories from the community again. We just loaded the new Engage platform. It was a switch over from CapWiz, so we're active with that. That's live. You can use that to look up your legislator. We've got a news feed on there. It's a great advocacy tool, but we can also tell HFA how specialty tiers have affected you and your family. And again, that helps us as we are here in Washington and then also all over the country be better advocates, so we have constituent stories. And you can see there's the link to that site as well. And so tell community members that it's really helpful for us to know these things and to move forward and to be able to walk in as we advocate for HR 460 and say this is a specific effect on a specific community member. So there's that. And then next slide, please. We also have up a Specialty Tiers Toolkit. It's being built out more, but to start, we have an issue brief, state talking points, copies of helpful studies. So if you are talking to a legislator or if you're seeing something pop up in your state, please go to that section of the site and download all those materials. They're there to help. And we will be putting up, as we see state legislation popping up, we've got some current legislation in Illinois, something just popped up in Louisiana. We've been working with the Maryland chapter on legislation there. There's also legislation in Minnesota surrounding specialty tiers. And it's already been passed in a few states. I know those are just a few. Delaware, New York, and Maine have enacted specialty tiers laws. So look to the site. HFA is here for you on that end. If you're seeing that pop up and you need some help, you know, they're great resources. And there's also the law in Delaware was really great, and a lot of the new laws that we're seeing has been modeled on that. So that's up there for you to take a look at, and it's kind of a best practices law. And again, we keep seeing it being replicated and copied all over the country. So this is another really great resource. And then finally, for my part of the presentation, next slide, please. We are having a policy internship this summer, brand new, 6 to 8 weeks. We're going to bring in 2 interns to Washington, D.C. So if you know of anyone that is 21 or over that maybe just recently graduated or about to graduate from college and is really interested in policy and advocacy work, government affairs, healthcare policy, really encourage them to apply. It is going to be, I think, a really great and immersive experience for someone with those interests. They are going to follow around the policy team in D.C. for 6 weeks and do everything we do. And I think, that's not necessarily an experience that a lot of interns get to have. We're going to take them to meetings. We're going to take them to the Hill, take them to briefings, and really give them a sense of what it's like to be an advocate for a patient community. I know that a lot of people in the community are familiar with that, and they go to Washington Days and they get that taste. But this is really kind of the background information on that. So we love people from young kids from member orgs to come out and apply for that and to be our interns. And then we also are allowing them to choose an organization that deals with blood disorders of their choice. If they, we didn't want to limit. If they happen to come from a state that doesn't have a member organization, but we'd really like for them to go back and spend 2 weeks volunteering at their member org as an advocate as well. So I think that's a great outreach and a great experience for that. And you can see the link to the site there as well. So that wraps up my part of the presentation, and those are just a couple of things happening on the website, some tools for the community. And next up is Janel.
One of the awesomest, greatest activities that HFA puts together is our annual symposium. Symposium 2014 is HFA's 20th anniversary, so we're very excited about all of the things happening in Tampa, Florida for the symposium. 2 great advocacy sessions at the symposium are the Dear Addie Live session and the Take Charge session. Dear Addie Live, it's going to be an opportunity for community members to present questions prior to the meeting, during the meeting, via microphone, and also they'll be able to submit questions in writing. There's so many things that are happening in the various states that we wanted to give people an opportunity to ask their questions on site, and that way we can have experts in the field answer them, and then we could also facilitate the conversation amongst advocates across the country, because there is perhaps something that would be beneficial for someone in California that someone in New York raises a question about. So we are very excited about the Dear Addie Live session. And then there's also the Take Charge session, and it's the Savvy Consumers Toolkit, where they'll learn how to navigate the healthcare road of life. It's going to talk about informed consent, the need for people to take responsibility for their health care, the fact that they have specific rights in order to move and advance their medical care forward. Next. And in terms of other great events, just like the internship that Katie mentioned, also this summer we're planning to have a HFA Hill Day, where we bring in community members from across the country, and they can go and they can talk with members of Congress, and that way they'll get a first-hand experience. For folks who have not done it before, they'll have an opportunity to meet with their various legislators. We're also going to have mini Hill Days for specific program areas, so look for that as well. And then for the Big Hill Day, we're also going to have a congressional reception, either the same evening or the very next day, where we will honor members of Congress for their work in moving forward the agenda for persons with a chronic illness, specifically hemophilia, and we just want to continue to partner with our legislators, and that way they'll know that we value them, and we can show community members not just the legislative side, but also the fact that we honor those who work with us and partner with us. Next up is going to be Wendy Owens talking about the CHOICE program.
Thanks, Janelle. So the CHOICE program has been ongoing. We're in our 3rd year now, and we just are very excited about the progress that we've been making, as are the people at the Centers for Disease Control and Prevention. We are collaborating with the CDC on this project. What we're looking to do is contribute data on people who have doctor-diagnosed bleeding disorders but do not receive care at hemophilia treatment centers that are federally funded. And we've been fairly successful thus far in reaching out and finding those people. Next slide, please. So just a little background on CHOICE. We have used a lot of community people to help us develop the survey, the CHOICE survey itself, and it's been great to have this participation and feedback. We actually went back to some of these people as well to revamp the survey, as we are using the participatory action research method, which means that we first ask our community what questions we should ask, and then once we've asked those questions in the survey, we go back to them and say, hey, did you like the survey? Is there something we need to change? So we've made some small tweaks, and we'll be posting that update soon. Next slide, please. So we really are giving people who do not receive care at HTC a choice, an opportunity to have their voices heard, because right now we don't know really anything about those people. And we have been able to find pockets of people and even individuals getting care at individual doctors around the country and learning more about what their needs are, and they actually have had the opportunity to learn about HFA as well. So I think that's been beneficial, and we're also putting them in connection with their local chapters. Next slide. So this is just missing 33%. The expectation is about 33% of people with doctor-diagnosed bleeding disorders are not accounted for from the data collected at hemophilia treatment centers that are federally funded. And so we're finding these people. They are out there, and a lot of them want to be heard, and they do want to talk to us. They do want to learn more instead of feeling a bit isolated. Next slide. Sorry, next slide. I'll just continue talking here. We have had over 300 people take the CHOICE survey so far, and that's been great. And I'm sorry, there's a little trouble going on. We have had 300 people take the CHOICE survey so far, learned a lot, both quantitatively in terms of the numbers and the data that we have, and also quantitatively by feedback that people have provided us. It's been very interesting to learn about what's going on.
Next slide.
I'm back, in case. Sorry, I can't see the slides right now. Then we've added one more year. The CDC has been very generous, and they are very pleased with the work that's been done by the HFA up until this point, and us finding these people that they have not been able to survey before. So they've added an additional year to the CHOICE grant. We're in the process of reapplying, which is something that's necessary, so they have all their I's dotted and T's crossed, and we're very excited about it. The other things that have come out of CHOICE, we have a further information to support our Blood Sisterhood program. We have a Access Working Group, which is a group of people looking at the issue of access for all bleeding disorder patients, whether they be in a rural area, underserved area, or even in large cities. So we're excited to going forward with CHOICE. We're going to be doing some data analysis and probably have some preliminary information to share. Next slide. So we want to say thank you very much for participating in this webinar. We appreciate you listening to what we have to say, and we're happy to answer any additional questions that you might have. If there are any questions currently, we'll take them. Otherwise, you can always reach us at advocacy@hemophiliafed.org.